first page is your cirrhosis guide. And this is just really important that you know a few things that I already talked about. Real quick for this guy. Jaundice means what labs are high? What lab? Watch it. Bilirubin. Write it. Jaundice means bilirubin is high. You gotta know your labs. Bilirubin is high. This itches, so your patient has pruritus. We're going to use for that itchy skin, Questran. Write it down, Questran. We're going to use Questran for the itching, or Colestipol as they call it. We can also use Benadryl for the itching. The first sign of jaundice is yellow sclera. Agree? Okay, move it down to esophageal varices. Now let's hang out there for a minute. Isn't that an upper GI bleed? Don't you know about that IVNG Foley? Okay, so you got me. Now, here's our problem. Do you remember me saying with the liver, it's a venous organ, all your veins are congested? When you have veins in your esophagus, all of those veins are congested. So imagine varicose veins that you have seen in patients' legs. Imagine that in your esophagus. So anything that increases the pressure in the esophagus is going to cause that patient to rupture those veins. What kind of things increase the pressure in the esophagus? Here we go. That's why constipation kills the patient. Constipation bearing down Valsalva. So you're trying to go really bad, and if all of us do a Valsalva right now, it increased pressure right in here, didn't it? Your patient can never be constipated. No cirrhosis patient can ever be constipated. They have to always be on a stool softener. They have to always be asked about when's the last time they went. Because when they bear down, they increase pressure in every vein, particularly that esophagus. And up comes all of this blood. Esophageal varices is painless. There's no pain involved with this. This guy is choking on his own blood, but he's not in any pain at all. The patient with esophageal varices is going to not just throw up blood, they're going to vomit copious amounts. So it's 500 cc's dumped out of their body. So you can imagine this is how it sounds. And they're going to die. Half of them are never going to make it out of this. Lots of blood. Suction is your first nursing action. Suction is your first nursing action with esophageal varices. Suction, suction, suction. Keep them sitting up because you're laying back, they're choking and aspirating. Our patient needs what we call a TIPS procedure, and a Blakemore balloon pump. Stakemore, or what is it? No. It's Blakemore, Sankston Blakemore crap. Blakemore is what you care about. Blakemore balloon. It's going to be 2 balloons put in the patient. Now, let's do the TIPS procedure first. Just so you know, and this is all you have to know, is the letters TIPS. Transjugular. And just stick with the veins, y'all. This is why you had to know anatomy, because I gave you all of these words already. Transjugular, here we go. Intrahepatic. Portal, all the veins. Systemic shunt. Look at the veins. All the liver veins are involved. The jugular, the hepatic, all the veins. TIPS procedure. Transjugular, intrahepatic, shunt. Oh, there it is. Okay. Blakemore, that word was important. That's why you saw me suffering there. Blakemore tamponade. You're creating a tamponade. This is why that word was so important. Blakemore tube creates a tamponade. Let me explain what a tamponade is. When this patient was throwing up like that for my husband, who was an RN at ICU at Murder Mount, the patient throwing up like that, you have to put a balloon to create pressure. You needed to remember that the balloon is in two places. It's in the stomach at the top, and it's in the bottom of the esophagus. And it's putting pressure against the veins at the bottom of the esophagus. So think, if I blow up a balloon and I have a balloon in your esophagus, I blow it up, it's going to put pressure on those vessels so they don't bleed. The one in the stomach puts pressure right at the top of the stomach where the varices also are, and it's going to put the pressure there. You had to remember there was two balloons, and you also had to know that that balloon that's here could become dislodged. And if it comes dislodged, it'll be stuck in the back of the throat, which is why every nurse has scissors at the bedside to snip it in the back of the throat if that happens. It can and it does. So your balloon tamponade, your TIPS procedure is what we do for esophageal varices. You can't do it. The doctor has to do it. You're going to do suction. Now, there was a hospital in the area that's since closed now. Horrible, would you say horrible urine. But that hospital's closed, funding or whatever else. But the nurse manager that was there was a Tri-State clinical instructor, and she had you guys at the site. She was a nurse manager and a clinical instructor. Well, the resident who was moonlighting got this guy in the ER, and what do you know about residents? They're still learning. He had no idea how to do the balloon tamponade. So the nurse had to teach him, because we know how to do everything that a doctor knows how to do, because we are there watching it every day, all day. I can deliver a baby in my sleep. That's why I went back to school, because I'm like, I'm doing this shit in my sleep. I can do this. I went to case because I'm like, I'm going to get paid for it. So your patient has this throwing up this blood. Your doctor doesn't know what to do. The nurse is talking him through. The students are mystified. They can't believe, she talked them through that. Because we all know how to do it. When you work in that field, you know how to do it. This is very high risk, both of these procedures. This patient, 50% or more are going to die from this episode of bleeding. They're going to get the blood transfusions, everything you know, right? PPIs, vitamin K. It's still an upper GI bleed, yes? You don't need no damn EGD, because, it's obvious. It's a cirrhosis patient. That, I can skip that shit. Save time. Okay, ruptured diverticulum, I already covered. Now, so we're going into cirrhosis. We already talked about the portal vein hypertension. One thing I want to say to you where that word ascites is, y'all see the word ascites? You're going to put right next to that word, portal vein hypertension. Because you've got to tie all this shit together. Portal vein hypertension. You've got to know what it is. Quote me. You're also going to make sure you know paracentesis. Paracentesis for ascites. Semifallus position. You're going to put next to hepatomegaly, right upper quadrant, next to splenomegaly, left upper quadrant. RUQ, LUQ. Okay? Next to hemorrhoids, you're going to write varicose veins in the rectum, because that's what the hell they are. Next to edema, you're going to write pitting. Next to peripheral neuropathy, you're going to write numbness and tingling, nerve damage. Numbness, tingling, paresthesia. Where it talks about sexual characteristics, you're going to write testicular atrophy and penile atrophy. What is gynecomastia? Man boobs. So here's the wrap up. Women look like men look like women when they become alcoholics. Now, once your dingling shrunk and your balls is gone, I would have stopped. Seriously, what do you need now? You can't even function. So this is a problem. The hirsutism is male pattern hair on the face, correct? Okay. Palmar erythema, red palms. Collateral veins on the visible on the abdominal wall. Let me just have you highlight that. Because I'm just trying to make you a good nurse. I mean, I know you're going to pass the final, but I'm just trying to get you out of here and make you safe. The bottom line, your admission that you did a physical assessment on, if they have veins on their freaking stomach, I don't care what they said they don't do. Usually they'll tell you they do it anyway. If you're loving, if you build trust with a smile, a genuine smile, they're going to tell you everything they do. They're never going to say exactly how much. I drink a little. Well, I just shoot a couple lines on the weekends. They're going to tell you what they do. When they say they drink a little and you see these veins, no, honey, they drink a lot and they have for 10 years straight. So this is the patient for esophageal varices, for pancreatitis, for delirium tremens, for a GI bleed, for a gastric bleed, for gastritis, for seizures. Everything that could happen does to a cirrhosis patient. Okay? All right, now you'll keep it moving. You'll see thrombocytopenia, coagulation disorders. Put your vitamin K, because they don't make vitamin K. The liver made it, right? The liver can't make it. And you're going to remember platelets are low. PTT are high. Yep, platelets are low. PTT are high. If you go up, you'll also see anemia. Do you see anemia in that little area? Okay, they're anemic, so you got to do H and H is low. Unneeded labs. The H and H is low. Leukopenia. Even the white blood count is low. Now let's remind each other why. The liver and the spleen share circulation. The spleen is your lymphatic organ responsible for infection control. They don't have any because they don't get any circulation to the spleen. So this patient does not get what they need to develop white blood cells. So leukopenia. Keep it moving. Spinal angioma, space, neck, and shoulders. You're looking at this dude, and they got women, especially. I see this with a lot of ladies. You know the bad drinker. They got veins starting down here, and they're in the neck, and there's some here. Bad drinker. Okay, now on the line for JDB. Changes in mental and responsive memory, blah, blah, blah. You know what time it is. Okay, turn page, keep it moving. PTT, I included that. Just put high with liver disease and put the time it takes to clot. The time it takes to clot. Look at what it says. Your heparin math, 1.5 to 2.5 times the control. Okay? 1.5 to 2.5 times the control. Be very careful. I don't know why they had the APPT. They should have just said PT. Agree? They should have just had PT, right? PC, PPT, don't want to confuse you. Now, both tests used to monitor heparin or Coumadin, it should say. Because which one's Coumadin? And PT. So write that on that sheet. PT and INR are used for Coumadin. INR, how many letters is INR? 1, 2, 3. Your INR better be 3. INR better be 3. So that's the average INR. 2.5 and up is fine. But what's bad? 4. Because I told you, INR, 3 letters, better be 3. PT and INR is Coumadin. Okay, now spironolactone. Why do I have this crap on here? Why would I put it in the inclusion of a liver patient? Because this is next to the liver handout. Because it's potassium sparing. Now don't you forget. Here's how I tell you to remember that. Write it on your sheet. The alcoholic is at risk for alkalosis, where all K is low. So far so good? You got this. And if the K is low, you don't need to get no damn Lasix. You need to give it, but not as much. Your patients do need Lasix, but they don't need as much if you use this with it. This is a diuretic, right? Okay, potassium sparing. Now, how you going to remember? Spironolactone spares the potassium. Keep it moving. Hepatic encephalopathy. And the next lab next to that one is what? Ammonia. So these two go together too, right? They're in order of the way you got to know them. So hepatic encephalopathy is all about ammonia. Here's what I want you to write at the top. At the top of the paper, you can see it says coma. Ammonia gives coma. That's all it is. Ammonia gives coma. The number one sign, really big, confusion. Write it really big. So slap your side of the head tonight and tomorrow for your test. Confusion, number one. Okay? Now, ammonia levels, I used to teach you based on a beer, but they got rid of the beer, so I don't know what to do with it. But the beer used to be called Coke 45. And Coke 45 was a good way to remember ammonia, because Coke 45 is a beer, which means it's an alcoholic lab. And 45 was normal. Anything under 45 was fine. Anything over 45 was hepatic encephalopathy. My nurse, who came from this class, she was in orientation, she told her preceptor, I'm concerned, my patient's got those veins, the collateral veins on her belly, and then she has them spider veins. Can you get an ammonia level? I didn't see one in the chart on the computer. And the preceptor was clueless. So she's like, for what? What does that got to do with anything? It's like, well, I mean, like, she's like, with the veins on the belly and the face, it might be a cirrhosis kicking, right? She's like, you're overkill. So she grabbed the resident instead, and he did pneumonia levels 81. So my fucking nurses they pick up on shit. 81. Crazy as hell. Okay, so you gonna pick up on shit. You're gonna come out of here pretty good. Stuporous. That's on the test. Most tests are gonna have that word, stuporous. You see the confusion? Look at neuromuscular disturbances. Here's what your patient's gonna do. And she had the patient do this. She said, I told Sean, her patient put their hands out. Shit was really unreal. I said, what happened, baby? She said, I told them put their hands out, and this is what happened. They didn't do it. Liver clap. That's called the liver clap, liver flap, whatever you want to call it. Look at the hands on your picture. It's showing you that the hands are just automatically clapping. Liver clap. You're checking, highlight it for asterisks. That's what that was, asterisks. This patient's reflexes, which is why I told you to check them on every patient, they're brisk, they're hyperactive. You tap every patient just to get a baseline. They're kicking you in your freaking chin. Tap, boom! They're just really hyper. Okay, so you know you got a problem. What in the hell is fetor hepaticus? It's piss breath. Their breath smells like ammonia. Yeah, man, their breath smells like ammonia. So it's crazy as hell. Now, here, well, hell, that's what's going on. Piss breath. Okay, so you got somebody smelling like piss, you know what's up. Okay, now here we go with that whole thing. You're going to put wet brain, because that's what it's called on the street. Wet brain equals Wernicke, Korsakoff, encephalopathy, and this patient needs vitamin B1, which is thiamine. Thiamine is found in nuts, particularly pistachios. That's why when you go to the bars, they got beer nuts on the table, so your little ass don't get wet brain. This is that compassionate. Beer nuts, man, I swear to God. That's why they on the table, beer nuts. Y'all thought the shit was planned in a way, because it is. They know your ass is crazy, about to have a soaked up brain. It's called wet brain. Now that whole penile atrophy, just so you know way patients talk, because again, you have to be a nurse first for the test. You got to take care of good people. This guy is going to tell you he has whiskey dick. He's going to tell you that. Yeah, man, this shit don't work. It's whiskey dick. What? Whiskey, it don't work. Just remember, that's what erectile dysfunction is with these patients. It's called whiskey drink, especially in the Indian community. Indians tell me that, all of them. Okay, now at the bottom, what kind of drugs you got? For every alcoholic, look at the drugs. Why you got the lactulose? To get the ammonia out. You know what you say to yourself on this test and on this drug? You say it like this. Lactulose is a laxative. It's going to make them poop. It's a drink. It's like no command or some shit. But it's a drink. Lactulose is a laxative to make them poop. What's in poop? Ammonia. Okay, so that's important. Then I want you to add, oh, you have it. It's vancomycin. I want you to add neomycin. It doesn't matter which one. Neomycin or vancomycin will kill the E. coli. The reason why you want to kill the E. coli is because it's a bacteria, and bacteria is a protein which breaks down to ammonia. Understand it like this. Very important that you understand the pathophys of the alcoholic issue. I sat up here and sang and talked and danced about digestion. I told you that the liver is going to take protein. It's going to make albumin. Okay, cool. Liver can't do that shit. So you're always walking around with a lot of protein. What does protein break down into? Protein breaks down into ammonia, uric acid or urea. And so your ammonia levels in this guy are very high. Nitrogen, waste. But the kidneys are okay, so that part is all right. But the ammonia levels is what's going to give this guy hepatic encephalopathy, medical emergency. Okay? My husband that got thrown up on with the esophageal varices, the original indication for why the patient came down from the floors to his unit, transferred from the floors to his unit. In report, he got the message, patient is confused. Prior, they were alert and oriented. So he's thinking, okay, fine, hepatic encephalopathy, let's go ahead and knock this out right quick. He went in the room to take the blood pressure. He just sat the patient up just a tiny bit more to do that. What happens when you sit people up? They create a pressure here, and that's when he vomited all over him, okay? So all of this goes together. If your patient can have hepatic encephalopathy, your patient can have esophageal varices. If the patient can have esophageal varices, they can have a GI bleed. If they can have a GI bleed and esophageal varices and hepatic encephalopathy, then they can have DTs. If they can have DTs, then they can have seizures. If they can have seizures, they can die. Okay, so it's all really bad. Okay? All right, now, seizure precautions. Seizure precautions. This sheet has more room on it, so I'm giving you everything that you need to do with the liver patient. Seizure precautions. The liver controls clotting, so bleeding precautions. This fool drunk, so falls precautions. Head of the bed up, because you don't know when the varices are coming. Foot of the bed up, because it's a venous issue, and we elevate our feet with venous issues. Head hose, because it's a venous issue. Skin care, because there's massive edema. Air mattress, same reason. Gel or air mattress, same reason. Skin care also because it itches. I'm just scratching their skin raw. Prepare to know that lactulose, Lasix, aldactone, I'll go through those three and then we're going to get more meds, a lot of meds. So we got lactulose, Lasix, aldactone. We have our PPI, vitamin K, multivitamin, calcium, stool softener, erythropoietin or iron, B12 injections, magnesium sulfate, Ativan and Valium, PRN. Magnesium sulfate, Ativan, Valium, PRN. Your Ativan and your Valium are called benzodiazepines. Ramazicon, we talked about already, and we're going to write it down again. Romazicon, which was flumazenil, reverses your benzodiazepines. Romazicon, which is flumazenil, reverses those benzos. Questran for pruritus. Thank you, baby. Questran. No, octreotide is not Questran. Octreotide may be needed for GI bleed. Yeah, so you can put that, I don't give a shit. Put your octreotide, child, but remember what it was. It was natriotide on the actual, yeah. Okay. Alrighty, we're done with our liver. Now, pull out your med packet. In your medication packet is the holy hookup. All your little GI antacids are in there. If you look at your GI meds, let's see, where are they? GERD and GI meds, it says. Oh, it looks, yeah. Yeah, there you go, baby. Oh, let's go see this. It's from Saturday. Yeah, that's from Saturday's meds. Okay, turn to GERD. Chop, chop. Now, let me tell you the easiest way to remember this. Every single one of these drugs are taken before meals, except for A for after antacids. So A for antacids means after meals. A for antacids, after meals. Everything else is before. Did you find the baby? Maybe that, oh, it's towards the back, yeah. Okay, so antacids, A for after meals. Everything else is before. It doesn't get any easier than that. Okay? They have to be on an empty stomach for the rest of this crap. Now, when it comes to antacid, highlight where I wrote. It neutralizes acid. This is, you can see it just as good as I can. Tums, Nocamag, Maalox, Mylanta, Rolaids, blah, blah, blah. Number one side effect, diarrhea. I would highlight that. Number one side effect is diarrhea. This is magnesium-based. How do you know? Because milk of mag, Mylanta, Maalox, M's. 3 M's for magnesium-based. No kidney failure patients, because magnesium is toxic to kidneys. No kidney failure patients. I might have wrote that. I don't know. Can't remember. Yeah, it says no. No, it doesn't say it. So you have to write it. Oh, I did write it. Yeah. Oh, yes. Contrary, I never read this shit. Unless I'm doing this, which is twice a year. Okay, so no renal patients for that. Okay, next on the list, keep it moving. Proton pump inhibitors. What did you have to know? Well, in this case, you're blocking HCl production. You're blocking the actual production. You have to know the action. That's what we're going over. It blocks the actual production. This is first line. Highlight first line drug with GI bleed. And then I gave you a whole bunch of other stuff that we use it for. Y'all see that? Okay, so see, that's going to be the bomb. Look at the burn patient. What kind of ulcer do they get? Curling irons. Don't they burn? Okay. H2s. Same shit, different day, but let me tell you the action. It's blocking histamine. You have to know your actions of these drugs. Blocks the histamine receptor. And if you look at the proton pump versus the histamines, look at what they end in. One's a prazole drug. The other one's Tidine. Tidine out of dinner drugs, before a meal. Okay, Tidine or Tidine, T-I-D-I-N-E, all of them end like that. Keep it moving. The last one on that page should say something about prokinetic agents. Yes? No? Maybe? Okay, so prokinetic agents. What the hell does kinetic mean? Move. So it makes your GI system move. In fact, quote me, it's already there, highlighted, speeds up gastric emptying. This is important because I taught you about ulcers. Do you remember me teaching you about ulcers? And I said that the gastric ulcer had a slow gastric emptying. Gastric slowed down, so the food stayed in there longer. You didn't have as much HCl. We said hypoproduction. What does Reglan do for that ulcer, that gastric ulcer? It speeds up the gastric emptying. How does this work on the other hand? Not only does it speed it up for the ulcer patient, get it out of the stomach faster, but it also helps with the post-op patient who might throw up and have a D&E. Dehiscence and evisceration means stitches popped. It's called dehiscence. Evisceration, because the stitches pop, organs are coming out. If you throw up and you're post-op, you just pop your stitches. So we give Reglan as an antiemetic post-op. It says that there, too. What is Reglan? Metoclopramide. Okay, so you see the Reglan there? It's cheap. We love it. Now, is it for duodenal ulcers? Hell no, because duodenal ulcers already had fast emptying. It was gastric empty so fast it hit the duodenum real quick. Okay, moving along. What did I tell you triple therapy was for, y'all? H. pylori. H. pylori can be the culprit in a whole lot of stuff that we talked about, but most importantly, H. pylori was seen in the ulcer patient. And this is why you had triple therapy. Just for shits, kicks, and giggles, what is triple therapy? Give me the drugs itself. PPI. Give me some. Flagyl. Biaxin. You gotta know those. You could do, no, not usually. Biaxin, Flagyl, they're not going to have that on there. And the PPI, triple therapy, 3 drugs, for 14 days.